Welcome back, East Texas. We are here with Christina Tinkler, PA for BoneCARE Clinic for CHRISTUS Trinity Mother Francis Orthopedics, and she's here to tell us how to prevent and treat osteoporosis. Had a little trouble pronouncing that this morning, but said it right that time. But what is osteoporosis?
Basically, osteoporosis is the thinning of the bone. The inside of the bone has a meshy matrix that becomes very brittle, and whenever it becomes very brittle, it has an increased risk for fractures and for breaking, and that's when you would get osteoporosis. And the word osteoporosis actually means porous. So it's very porous bone. You can just see the difference.
Okay.
Okay.
This
is so the one on the left. Sorry, that one is the one.
Yes, this is an osteoporotic bone, and this is a normal bone.
Wow,
so you can really see the difference.
Yeah.
So how does it get brittle? What is the cause of that?
Well, a lot of times some of the symptoms or the causes are a low body weight, a family history of osteoporosis, poor diet, low calcium, low vitamin D. Being on steroids for prolonged periods of time for COPD, diabetes type 1, the bone is just, it's not able to regenerate itself.
Okay. And
what would you say most people don't know about osteoporosis?
Osteoporosis, it occurs very frequently. After the age of 50, 50% of females will sometimes in their life develop osteoporosis, and 1/3 of males will develop osteoporosis as well. So one of us in this room is most likely going to develop osteoporosis.
Wow.
Is there a way to detect this early, and how important is it to maybe seek out early detection?
Yes, you can detect it early on. I would just recommend, especially if you've had a strong family history, to be on top of it. But in your mid-50s, it's good to go and get a DEXA scan or a bone scan to detect if you have osteoporosis. There are some labs that we can do also that show low vitamin D, low calcium levels. And if we can pick those up, we could hopefully start treatment and possibly prevent the osteoporosis from worsening. Because if you get this osteoporosis, you can have something as simple as a ground level fall could break the bone, as you can see, since it's so thin. And a hip fracture has a very, very high morbidity and mortality rate, especially in the elderly.
Oh, wow.
And say you are diagnosed with osteoporosis, what are some treatments?
The treatments, of course, we would make sure that you have adequate amounts of calcium. Vitamin D is very important. Vitamin D helps the absorption of calcium to where it actually pulls it out of the digestive system and helps absorb it. And there's a lot of medications that can be taken by mouth that are not over the counter, but they're prescription. And some of the newer medications that are working wonderfully, they actually help stimulate bone growth by injections. And there's some also that can be given by a sub-Q injection every 6 months.
So some of the preventable measures, what are some ways to help prevent that? Is it as simple as taking vitamins? You mentioning like vitamin D and whatnot. Is it as simple as that?
It's not as simple as that, but a good healthy diet, exercise to whatever you feel like you can tolerate is good, and just knowing your history, and if you've been on certain medications like steroids, like prednisone or something like that, be aware that that can cause osteoporosis later on in life.
Sure.
Great. And so where can people contact you if they have any questions about this?
I work at the Bone Health Clinic. And it's through CHRISTUS Trinity Mother Francis Orthopedics group, and they can give us a call and we can get you in. And I have a DEXA scanner in the office as well as a lab right across the hallway, so it's more convenient, especially for our elderly patients, to where they don't have to be walking back and forth.
Absolutely.
Great, Christina. Thank you so much for coming this morning.
Thank you for having me.
Yes, of course. All right, well, coming